Trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening and can have lasting adverse effects on their functioning and mental, physical, social, emotional, or spiritual well-being. For example, a person may experience trauma from an event like a mass shooting, physical assault, rape, violent accident, or after natural disasters such as hurricanes or tornadoes. Trauma is also associated with experiences by military personnel, veterans, or victims of war. Types of trauma disorders include the following: post-traumatic stress disorder, PTSD, is a disorder that can be caused by experiencing, witnessing, or hearing about a traumatic event. After a month of being removed from the event, a person may continue to experience sleeplessness, increased heart rate, mood shifts, physically lashing out, or any combination of responses. These responses may be brought on by any environmental stimuli that reminds the person of the terrifying event, or by recurring thoughts about the event. Acute stress disorder is a disorder that has similar symptoms as post-traumatic stress disorder, but the symptoms only last for 3 days to 1 month. If symptoms last for longer than 1 month, it meets the criteria for PTSD. This disorder is experienced by individuals who have been exposed to actual or threatened death, serious injury, or sexual violence. It can be caused by directly experiencing the event, witnessing the event, learning the event occurred to a close family member or friend, or experiencing repeated exposure to details of traumatic events. A person's personality is a relatively stable pattern of thinking, feeling, and behaving that evolves over their lifetime. A personality disorder is a pattern of inner experiences and behaviors that deviates from the expectations of the individual's culture. It can be traced back to adolescence or early adulthood and leads to impaired functioning the remainder of the person's life. There are 10 types of personality disorders that can include distrust of others, isolation, habitual lying, and aggressive or violent acts with little remorse. 3 common personality disorders are as follows: obsessive-compulsive personality disorder. OCD includes a pattern of preoccupation with orderliness, perfectionism, and control. This preoccupation may impair one's social life, health, or ability to function in the outside environment. This is the most common personality disorder in the United States. Borderline personality disorder. Borderline personality disorder includes a pattern of instability in interpersonal relationships, altered self-image and emotions, and significant impulsivity. People with borderline personality disorder may experience chronic feelings of emptiness and exhibit frantic efforts to avoid real or imagined abandonment. They may have difficulty controlling their anger or experience dissociative symptoms where they feel detached from their body with a loss of memory of the experience. Narcissistic personality disorder. Narcissistic personality disorder includes a pattern of grandiosity, need for admiration, and lack of empathy for others. Prolonged, repeated misuse of substances can produce changes to the brain that can lead to substance use disorder. Substances may include alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, or misuse of other prescription or over-the-counter medications. All these substances taken in excess have a common effect of intensely activating the reward system in the brain so much that normal life activities may be neglected. Substance use disorder, SUD, is an illness caused by repeated misuse of these substances. Over 40 million Americans are diagnosed with SUD, 14.5% of the population. Severe substance use disorders are commonly referred to as addiction. Addiction is associated with compulsive or uncontrolled use of one or more substances. Addiction is a chronic illness that has the potential for relapse or recovery. Relapse refers to the return to substance use after a significant period of abstinence. Recovery is a process of change when individuals improve their health and wellness and strive to reach their full potential. Individuals with severe SUD can overcome their disorder with effective treatment and regain health and social functioning, referred to as remission.